Hello again, everyone. So, total failure. I had to leave for my meeting and now I'm back. So, you have two separate sections of the lecture. So, to recap, check out this awesome illustration. It is pretty cool of what can happen to the same person, same body with two different representations of hormonal secretion. All right. Hyper or hypo, in this case, cortisol. All right. Diseases of the pancreas is what we're in. Type 1, just to recap, make sure you watch out for glucose monitors, insulin pumps, things of that nature, okay? And I want you to pause and look at this hyperglycemia and hypoglycemia chart. I am going to quiz you on it. All right, here's some more need to know about massage and insulin pumps. Type 2 diabetes occurs when cells are resistant to insulin. All right. They have insufficient levels of insulin production. Um, or I should say, it's either they are resistant to insulin, which is the most common, or they have insufficient levels of insulin that's actually being produced by the pancreas. There are other diseases like insulin resistant polycystic ovarian syndrome that will cause issues that are similar to type 2 diabetes without actually being type 2 diabetes. So you can be diabetic-ish without actually being diabetic, if that makes sense. This is usually controlled by diet, exercise, um, oral hypoglycemics in some cases. If you get hyperglycemia, sometimes you will require insulin replacement therapy, but not as much in the case of type 2. Now, you can get diabetic foot ulcers. Those are wounds that extend through the dermis, right? So through the epidermis and then through the dermis. The dermis is the layer with the nerve endings and all of the sebaceous glands, the apocrine and the eccrine sweat glands, all of that stuff is in there. All right. And they are usually located below the ankle on weight-bearing or exposed surfaces of the skin. Diabetic foot ulcers are one of the most common complications associated with diabetes mellitus, with a lifetime incidence of up to 34% of people. All right. More than 50% of diabetic ulcers become infected, and 20% of those will be severe enough to result in amputation. All right. The surgical removal of a limb like a foot, leg, or other body area. Residual limb pain is something that's an interesting phenomena. Awful for the people that suffer it. Fascinating to me as a nerd who likes this kind of stuff. It's also called stump pain, not a very attractive term. But here we are, that's life. It's pain felt in the remaining portion of the limb after amputation. Phantom limb pain is pain originating in an area of the body that has been removed. They can feel tingling, itching, burning, throbbing, all of these things in the area that the limb once was, even though it is there no longer. All right. Similar to type 1, you will get polyuria. Remember, you're just going to be peeing all the time. You're a sprinkler. That's excessive urination, polydipsia, or excessive thirst all the time. You're going to be thirsty, and excessive hunger as well. People with type 2 diabetes very often are obese. All right. They are constantly craving food. All right. Persistent hyperglycemia damages cells and leads to complications such as vision problems, all right, including cataracts and diabetic retinopathy, lack of muscle control, and reduced sensations or paresthesia, all right, called DPN, and diabetic foot ulcers, which we just talked about. Neuropathic pain often increases throughout the day and then worsens at night, which can interfere with sleep. And they are very prone to fungal infections like thrush, jock itch, vaginal yeast infections, athlete's foot. You can also have kidney, cardiovascular, neurologic conditions, kidney failure, hypertension. Remember, hypertension is high blood pressure, coronary arteriosclerosis, arterial disease, heart attacks, and strokes are all associated with type 2 diabetes. What do you need to know about massaging someone with diabetes? The main thing is to watch out for a hypoglycemic episode. All right. So we're going to check out for if they have slurred speech, if they have cold and clammy skin, if they're sweating, if they're not feeling very well. All right. Watch out for these things. If they take injections of any type, you're going to avoid vigorous massage in that area for 24 hours. Okay. If they do insulin injections, all right, and you massage over it, you could increase the absorption rate and decrease their blood glucose levels and cause hypoglycemia. Congratulations. You need to inspect their feet each visit, looking for sores, broken skin, objects embedded in the skin. They usually won't feel these things. And a lot of people aren't very good about self care in terms of like checking their feet every day to make sure that these things aren't occurring. So please be aware of that. They may go completely unnoticed by the client because they have a loss of sensation. And of course, they may also be suffering a loss of vision, right? From the diabetic retinopathy. So please be aware of that for sure, and really reinforce the client to indulge in self-care and daily self-evaluation. All right, you check them every session. You encourage them to check themselves every day. Safety is an important consideration with people with diabetic peripheral neuropathy. They can't feel things. They can't feel things. So make sure that you have removed things that they can trip on if they can't see well, if they can't lift their legs well, and use light pressure on them. All right. Massage and amputations. If the client has an amputated limb and post-amputation pain, massage is absolutely recommended. Follow post-surgical guidelines. I should definitely do a post-surgical group of modality videos for you guys, but avoid vigorous massage on the lower extremities, the thighs and legs, for 12 weeks after surgery because of the increased risk of blood clots or venous thromboembolisms. All right. Avoid the incision area wherever that may be, or until it is dry. It's not moist. All right. We want it dry. We want it not moist at all. All right. We want it complete like Sahara on that stump, which may take at least 8 weeks, potentially longer, depending on drainage. These do have a tendency to drain for quite a bit and seal up slowly, healing internally very often first with internal stitching. So please be patient and do not massage any moist areas with this. You could lead to bacterial infection, increased pain, et cetera, et cetera, et cetera. Massage and scar mobilization is absolutely indicated. You definitely want to do some scar tissue massage for these clients. Sometimes prosthetics, though, can cause the skin to be chafed or have friction wounds. So please make sure that you're paying attention to irritated or broken skin and bring them to the client's attention. Also, I would highly recommend if they have a prosthetic device that goes onto the arm or leg with some type of cap or slides on in some type of manner, make sure that you talk to them that you're using like a potentially a cream or a water-based thing rather than an oil emollient, just in case that's going to affect issues with adhesion or the prosthesis slipping off. Okay. There's some interesting research here for you about massage and amputations if you would like to read it. And the last thing I want to throw out here, just as an FYI, if you ever want to research it, there's some really cool photography out there where they have measured the electromagnetic field of people who have had amputations, and they can still see the electrical signals that the body is still giving off. I actually got this image out of your pathology textbook, not off of a random internet site, but I thought it was cool. they can actually see where the limb once was by the electrical signals being given off by your nervous system. Your nervous system, in a lot of cases, still believes that it's there, and it's referring those pain signals back. I do have a lot of videos for you guys available about chronic pain, especially from a doctor at the University of Michigan, where chronic pain is actually centered in the memory center of the brain, and not actually a nerve impulse that you're feeling at all, like acute pain. And this could potentially be tied to phantom pain with amputations because you're remembering of the pain of the limb that was there, even though it's not physically there anymore. You're still experiencing, unfortunately, the discomfort of it. Isn't that the way of life usually? So that is all I have for you today. Sorry for the two different videos, and I will see you guys tomorrow.